Hello, Pahrump. We were just talking with Chuck, relating information about the FDA, the control that the FDA has over the pharmaceuticals and the food and the stuff that we intake into our bodies. Chuck, would you like to proceed with what you were saying?
Yeah, the one thing I'd like to point out is the FDA does no studies of medications or anything. What they do is supposedly review the studies that are conducted by Big Pharma. And these studies cost a fortune, 500 grand and up. So not every Tom, Dick, and Harry that has a great thing that might, cure cancer or whatever, they can't afford the study, so they're eliminated from the very start.
Yes.
And like I say, the FDA is totally subservient to Big Pharma. There's a revolving door between Monsanto, Big Pharma companies, and the FDA. And they go back and forth several times. They'll work for one of the Big Pharma companies, and they'll be with the FDA for a stint, and then they'll go back to the company and then back to the FDA. And it's absolutely criminal. And obviously the intent has been to have a monopoly over what we put into our bodies. And anyone that looks at cancer rates, autism, and all the rest knows that something is drastically wrong with the skyrocketing incidence of disease. But yet we never have any cures. They keep us alive as long as possible because we're the source of all that money, but they don't cure us.
Yeah, that's interesting. Last week we talked about marijuana and cancer treatment with it, and it's so interesting to me that the cost of cannabis, marijuana, to treat cancer is almost nothing compared to what the chemotherapy and the radiation therapy. Some of these drugs that they're using to treat cancer are $3,000 to $5,000 an injection. Well, $3,000 to $5,000 would buy you 5 acres of marijuana. So I mean, it's just it absolutely is insane what they get away with. But at that time in a person's life, where it's life or death, they're going to sell everything they have to try to hold on to their life and to try to maintain some quality of life. So, but I agree with you that in many instances, we as a population are like puppets, and the majority of people out there are saying, "What do I do? What can I do? Where can I go? Can I go to my senator? Can I go to my representatives?" Well, they're all part of the government. So, I don't have an answer to what you're saying, but, we see that. I think as a population, we see what's going on related to health care, related to medication. Why, if vitamins have been around for hundreds of years and people have been taking them, do they feel the need to control that industry? They feel the need to control the natural holistic approach to health. Well, it all breaks down to the natural holistic approach to health. In many instances, you're successful with it, and it cuts into their revenue.
Exactly.
It cuts into the revenue. So, but I don't know how to answer your question. I mean, I've done some studying on marijuana this week since we talked about it last week. And what'd you say, 1937 is when they come in and outlawed growing it?
Well, that was when they put in the hemp tax, which basically, made it impossible for farmers to grow it.
Which to me, you look at hemp and you look at, right off the top of your head, how many uses for hemp can you state?
It's incredible. Everything from clothing to paper to food. It's one of the greatest sources of essential fatty oils and fatty acids. Linoleic acid and LNA and LA acid.
Well, both of those fatty acids are essential fatty acids that you have to get in your diet, along with arachidonic acid. So, so you got to ask yourself, if there's all of these uses for hemp, why would they put a tax on it so that people would not be able to grow it or use it? But the answer has to be because they can't control it.
Well, plus it interferes with their monopoly on plastics, on medicine, on everything else.
Which all cause cancer.
Exactly. Well, I'm going to hang up. I don't want to dominate the line. Thanks
Well,
a
you know,
lot,
I really appreciate you calling because, you know, just like with Ray, you cause people to think. Listen, this show is only as good as the questions that come to us, Chuck, and you always stimulate, you know, the conversation, and we're really grateful for your input.
Well, thank you. I'm grateful for guys like you because you're the last line of defense, in my opinion.
Well, thank you.
Thank you very much.
Okay, I want to talk about the Wellness Center. I want to talk about the things that we do here in Pahrump to help with the quality of life of our patients. You know, we are a holistic center, and utilizing Dr. Reiner as my partner, we also utilize Western medicine in combination to help service the community, to help increase the quality of life of our patients. You know, we pride ourselves on getting people well as quickly and as soon as possible with the reduced use of medications. We only prescribe it, we only utilize it when it's absolutely necessary. We push diet, we push exercise, we push stretching, we push, you know, all of those things that will help you become more healthy without the adjunct of all of the medications. Amy.
Hi. It's good to talk to you, Dr. Christensen. I have a couple of things.
Good.
On your new endeavor with Dr. Reiner, how is the billing going to be handled? Do we have billing that goes directly through Independent Wellness Center?
Yes, it'll all be handled through there. We take, you know, Medicaid. Medicaid patients are important to us because they need a place to go and be taken care of. We take Medicare. The aging population that are on Medicare are looking for an alternative approach, you know, to helping them with their aches and pains without being dependent on the medication. We take 99% of all in group insurance programs out there. We do a lot of auto accidents because, I mean, people don't realize how bad you can get hurt. You know, people think that a minor fender bender is not a big deal until about a week after the accident, and they can't move and they hurt. But we try to work with every patient to make it easy on them, to make it affordable because, you know, we know in this day and age, the people have to eat also. So, but the billing is done through Independent Medical Center.
Well, I do have a lot of faith in chiropractors. My uncle was president of the Chiropractic Association in Texas for 18 years.
Oh gosh, that's
popular.
Great. Yeah, that's great.
Yeah, and I have another question. I'm bringing it up to my second question about kinesiology. Do you have any experience with kinetics in your practice?
Oh, absolutely. Kinesiology is a study of movement and muscle. It's a great big word for, you know, understanding the musculoskeletal system and the biomechanics of each joint. But chiropractors are trained pretty extensive in kinesiology, exercise physiology, and biomechanics. So yes. Oh,
that's great to know because there's really wonderful results in it. And my friend Chuck covered the cannabis and the hemp. We communicate a lot about the new approach and as natural as you can get. So we're real excited about your joining in with Dr. Reiner. It's a great addition, and I hope to be seeing you myself pretty soon.
Well, we look forward to seeing you, Amy. We look forward to seeing you, and thank you for your questions. Again, we're only as good as the questions we get from our audience, so please keep those telephone calls coming. But back to the Wellness Center, we're going to be implementing a yoga program We're bringing in a yoga teacher to teach yoga and to have the classes there at the office, because, you know, as human beings, stretching is one of the most important things that we need to do, especially as we get older, to keep those joints and those limbs functional, keep the range of motion moving, and just keep yourself moving without the pain and agony of having those sore joints. So we're looking forward to bringing that program in probably the middle of August. Probably Tai Chi. We're going to look at bringing in a class for Tai Chi, which is another excellent discipline for movement and low impact exercising, which really helps those people that are hurting. Listen, we have a minute left. We're going to go to commercial. Again, think about what you need answered, and when I come back, give me a call. Thank you.